If you look at this model that's showing the male reproductive system, you can notice that this is the beginning of the male urethra. Starts from here, and as we know, it is prostatic inside the prostate, membranous urethra inside the membrane, which is this, and then the rest is called the penile or spongy urethra. If you look at the beginning here, this piece of the muscle of the bladder surrounding the beginning, this part right here, this is called the internal urethral sphincter, and this is the involuntary one, which is this part and this part. If you follow further, you will see this and this. These are the external urethral sphincters, and it is within the urogenital diaphragm. Now this can be a little bit confusing, but this whole thing, the whole thing here with the surrounding white, the whole structure here, this is called the urogenital diaphragm. Inside the urogenital diaphragm, you see this muscle, which is called the membranous muscle, and you will see this muscle inside on either side of the urethra, and this will be the external urethral sphincter, which is voluntary muscles that control the urethra. So internal urethral sphincter surrounding the beginning of the urethra, and external is right here surrounding the membranous part of the urethra right here. And again, this whole thing here with the surrounding membrane and everything, this is called the urogenital diaphragm, inside which are these membranous muscles, and the other muscles here are the external urethral sphincters. If you look at this, we talked about this. This is the Corpora Cavernosa, and we have two of those. And this would be the Corpus spongiosum, actually, because it's only one. But the thing here is, if you follow this and go right here, you'll see this as the glans, and obviously it's the same color of the Corpus spongiosum. So the Glans Penis is an extension of the corpus spongiosum, and this is the bulb or the root of the penis, and again it is an extension of the spongy corpus spongiosum. So again, this is the corpus spongiosum extending forward and enlarging here, giving you the glans. So it's making the glans here, and it's extending in the back here, still the corpus spongiosum extension here. It's giving you the bulb or the root of the penis. If you look at this model, the dartos muscle, which is this muscle here, that is under the skin of the scrotum, under the, deeper to the scrotum or under the skin of the scrotum. So this is called the dartos muscle, and the other muscle is the muscle that pull the testes upwards, which is cut open here. You can see the rest of it from this side. So it's here, which is surrounding the inside of the spermatic cord, and you can see it more clear here. So this muscle surrounding the spermatic cord and surrounding the testes is the cremasteric muscle. So remember, we have two muscles. This one right here is called the dartos muscle, that's surrounding, not attaching, it's surrounding to the testes, and this one here is actually inside the spermatic cord, and this what pulls the testes upward. And as you see here, this is the testes, this is the epididymis, this is the spermatic cord, and as you see here, spermatic cord is entering to the pelvis, and this opening through which this spermatic cord enter is called the inguinal foramen and inguinal canal. So the route through which the spermatic cord enter to the pelvis is the inguinal canal.